I'm Sandra Poirier. I'm 56 years old and a registered nurse.
I'm Doris Chevry, and I guess I'm here to talk about my heart.
I went to the Moncton Hospital where I had a stress test, and they referred me to a cardiologist in St. John.
I had a heart attack, and I have unstable angina.
I did another stress test and so on, and decided that I needed to have surgery.
I guess it was like really bad heartburn that went right in my back, nowhere else. Not in my arms, not in my jaw, nowhere. And I just thought it was something that I ate.
Following your cardiac event, you and your family will probably have a lot of questions. This presentation will help you understand what is angina and myocardial infarct, or commonly called a heart attack. You will also learn how to modify your lifestyle to avoid having a recurrent cardiac event. The heart pumps blood to all of the body's organs in order to oxygenate them. The heart itself is fed oxygen by three main coronary arteries. Angina is a chest pain or chest discomfort that you will feel when the heart does not receive enough oxygen and blood. Typically, angina will be felt as a pain in the chest. It may be some pressure or vice-like chest pain, or sometimes just a vague discomfort. It may also irradiate to both shoulders, down the arms, to the neck, jaw, teeth, and sometimes to the back. Angina will typically happen when you're doing some physical activity and will be relieved by rest. It may also happen during psychological stress. It is important to note that angina does not cause any damage to the heart. When the angina is only on exertion, it is called stable angina. Angina is usually treated by controlling your risk factors. It is very important to control all risk factors to decrease the chance of having a recurrent cardiac event. Angina will also need medication to slow down the heart rate and to control the blood pressure, which will decrease the work of the heart and also decrease the chest pains. If medication does not prove to be sufficient, we may sometimes proceed to angioplasty, or more commonly called the balloon. This consists of passing a balloon across a clogged artery, and then when the doctor inflates the balloon, it pushes the cholesterol plaque towards the wall of the artery and opens up the artery, leaving the blood to flow more freely and to control the angina symptoms. Often, we will also put in place a small metallic tube called a stent to keep the artery open more efficiently. If angina is not controlled by medication or angioplasty, we may proceed to coronary artery bypass grafting or cardiac bypasses. This consists of using an artery from the chest and/or a vein from the leg and creating a bypass around the clogged artery, giving sufficient blood to the heart to relieve his anginal chest pains. You may also hear the term acute coronary syndrome. This consists of an acute myocardial infarct or heart attack and unstable angina. Unstable angina is a typical anginal pain that occurs unexpectedly with very mild activity and sometimes at rest. In general, the pains will come more often, last longer, and not be relieved as nicely with nitro.
You should consult your doctor if any of the following occurs: increase in frequency of discomfort, increase in duration of discomfort, increase in intensity. Consult a healthcare professional immediately if the pain occurs at rest or if it wakes you up at night. Angina-related pain or discomfort is usually treated with nitroglycerin, which dilates the blood vessels and increases oxygen supply to the heart. If you are experiencing pain, you must stop all activity. Sit or lay down. If rest does not relieve the pain, take 1 pill or 1 aerosol spray of nitroglycerin, noting the time when taken. After 5 minutes, if the pain is still present, take a second nitroglycerin. After another 5 minutes, if the pain persists, take a third dose of nitro. If you still feel pain after taking 3 doses of nitroglycerin, have someone drive you to the hospital immediately because you could be experiencing a myocardial infarction. It is best to call 911 because paramedics can give you oxygen on the way to the hospital. This will help deliver oxygen more effectively to your heart and ease your discomfort.
A myocardial infarction, also known as a heart attack, is caused by an obstruction of one of the coronary arteries giving blood to the heart. This is usually associated with some degree of damage to the heart. This blockage is caused by a blood clot, which is superimposed on a cholesterol plaque and occludes the blood flow to the heart, causing pain. The pain is usually very similar to the anginal pain, but more intense and more prolonged. In addition, it is often associated with other symptoms such as nausea, vomiting, shortness of breath, diaphoresis, cold sweats, or just a generalized feeling of anxiety. Numerous treatments are available for the treatment of an acute myocardial infarct, but to be effective, they have to be administered rapidly. For that reason, it is very important that you consult a healthcare professional as soon as possible. After your cardiac event, you will receive certain drugs to treat coronary artery disease. These include drugs to prevent clot formation, such as aspirin and clopidogrel, as well as other drugs called ACE inhibitors and statins, which decrease the chance of having a recurrent heart attack and also decrease the chance of having fatty deposits build up in your arteries. These drugs will decrease the likelihood of having another cardiac event, such as a heart attack, unstable angina, or even sudden death. They will permit you to lead a healthier lifestyle. However, to be effective, they have to be taken for the long term, and most of them, in fact, will have to be taken for life.
So if I understood correctly, that I'm to take my medication as the doctor prescribed and to consult my doctor if I have any adverse effects right away?
Yes, exactly. It's important not to stop taking your medications before speaking with your doctor first. It's also preferable to always go to the same pharmacy. That way the pharmacist will know you better and will be able to serve you better. If you like to buy any natural products or over-the-counter products, always speak to your doctor or pharmacist beforehand because some of these products can alter the effects of the medications that you're taking. Also, grapefruit juice can alter the effects of your medications. So if you'd like more information on that, you can speak to me or your doctor.
Thank you.
Risk factors are conditions or activities that predispose to coronary artery disease. The more you have, the greater your chance of developing heart problems.
The risk of heart disease increases with age. Men are more vulnerable to heart disease than women. However, after menopause, the risk is the same for men and women. People of South Asian, Aboriginal, Inuit, or Black descent are at increased risk of heart disease. In addition, if someone in your immediate family experienced a cardiac event, man younger than 55 or woman younger than 65, you are at greater risk. The second type of risk factor is modifiable. These include smoking, high blood pressure, hypertension, dyslipidemia, diabetes, and lifestyle. Smoking is a very serious risk factor. Tobacco damages the artery walls and increases the accumulation of fatty deposits in the arteries. 1 year after you stop smoking, your risk of heart disease is cut in half. There are different methods to help you quit smoking. Ask a healthcare professional for assistance. High blood pressure exerts pressure on the blood vessels and forces the heart to work harder. By reducing your blood pressure, you will protect your heart and reduce its workload. High cholesterol or triglyceride levels can also increase your risk for heart disease. Cholesterol tends to stick to the blood vessel walls, which makes blood flow more difficult. A dietitian can offer you nutritional tips to help you manage your cholesterol more effectively. After a myocardial infarction, cholesterol levels must be kept as low as possible. This is why cholesterol-lowering drugs are prescribed. These are used to complement, but not replace, a healthier diet. Over the long term, an excessive amount of sugar in the blood, diabetes, damages the blood vessel walls, and promotes fatty deposits. Therefore, it is very important to control your blood sugar levels if you are a diabetic. Lifestyle is a risk factor that is becoming more and more prevalent. Weight management plays a key role in the prevention of heart disease. You can achieve a healthy weight with good nutrition and exercise. Lack of physical activity reduces muscle tone, promotes weight gain, and impairs circulation. The Heart and Stroke Foundation recommends 30 to 60 minutes of moderate exercise most days of the week. These activity sessions can be divided into 3 periods of 10 minutes or more. It is not necessary to do one session of 30 or 60 minutes at once. Physical activity is a good way to manage your weight, cholesterol, and blood pressure. It also makes you feel better. Stress is a part of your daily life. Know how to identify negative stressors and find a healthy way to manage them. Do not attempt to change all your behaviors at once. Change only one thing at a time. However, you should stop smoking and start exercising right away.
Following a cardiac event, you may feel afraid, angry, or even depressed. Those reactions are normal. However, it is important to recognize them, to deal with them, and to talk to someone about them if you have any questions. You and your partner probably have concerns about resuming your sexual activities. In general, however, you may return back to a normal sex life once you're able to walk up 2 flights of stairs or approximately 28 steps without any chest discomfort or shortness of breath. If you have any questions, please ask your cardiologist. As with any other physical activities, resuming sexual relations must be done gradually. It is important to wait 1, 2, or sometimes even 3 hours after a large meal, to avoid taking too much alcohol, and mostly to choose a time when you're relaxed and well rested.
Evidence shows that for some people, atherosclerosis can begin at an early age. This is why it is important to have healthy eating habits from childhood.
It's very, very important to have a good diet and to have 3 meals a day. For breakfast, I try to choose 3 groups of food from the Canada Food Guide, and they are generally, I usually have in the morning oatmeal, bran, skim milk, and part of an orange or orange juice.
Had my whole wheat with peanut butter and banana with skim milk this morning, which is good, yeah.
Very good choices. I also, when I'm eating, try to limit things like coffee, and of course alcohol is something that has to be limited when you have heart disease. It's very, very important to have a good diet.
So that we can have a healthy life for many years to come.
Let's compare some products with the help of a registered dietitian.
Start by substituting hard margarine blocks, shortening, lard, and butter with non-hydrogenated vegetable oils, such as canola oil, olive oil, and soft non-hydrogenated margarines. Choose lean cuts of meat and poultry. Avoid high-fat meat, such as bacon, bologna, sausages, and spare ribs. Choose low-fat or fat-free dairy products. Reduce the amount of commercial pastries and sweets which contain coconut or palm oil, also known as tropical oils. Introduce animal and vegetable-based foods that are rich in omega-3 fats in your diet. For example, salmon, tuna, mackerel, trout, herring, omega-3 enriched eggs, ground flax seeds, canola oil, and walnuts. Reduce the amount of refined foods such as white breads, sugary cereals, and all sweets. Choose whole grain and multigrain products more often. Cereal products that are rich in soluble fiber such as psyllium, oat bran, ground flax seeds, brown rice, and barley should be part of your daily diet. Adding ground flax seeds or oat bran to your homemade pizza doughs, muffins, or stews is an easy way to increase the soluble fiber in your diet. Choose vegetable proteins more often, such as legumes, nuts, seeds, and soy-based products. Legumes, such as peas, beans, and lentils, can easily be added to soups, salads, or rice dishes. Legumes can be found dried, canned, or frozen. And finally, we suggest that you eat a good variety of fruits and vegetables every day.
During your first weeks back at home, take it easy. Gradually increase your activities after the second week with the goal of achieving a more intense and sustained level of activity by the fourth week. Don't wait. Start now.
Exercising will increase your quality of life, mentally and physically. The best way to do it is to start off gradually. Make sure you take your rest periods in between. You don't want to overdo, and just get out there and have fun.
If, during your activities, you experience symptoms such as shortness of breath, palpitations, dizziness, angina pain, nausea, vomiting, or excessive sweating, stop. You can resume your activity once symptoms subside, but slow down your pace. If symptoms become more frequent, either at rest or during exercise, consult your doctor.
It is very important to exercise regularly to promote heart health and rapid healing. Join a walking club in your area or the cardiac rehabilitation program called Cardiac Wellness Program. A cardiac rehabilitation program will help you to improve your physical fitness, improve your quality of life, reduce your risk for a recurrent cardiac event, adopt an efficient and personalized exercise program that is both safe and suited to your health, age, and physical ability. Finally, it will also get you ready for your return to work.
When I walk or exercise, I make sure that I wear comfortable shoes and clothing. Wait an hour after a meal before starting my activity. Do stretching exercises before my walk, and that I slow down at the end to recover well. Am able to talk while walking. If I cannot talk or have difficulty breathing, I am walking too fast. I must slow down. Do not lift or carry heavy objects for the first 6 weeks. I must use a cart or slide objects whenever possible. When I walk or exercise, I make sure that I wear comfortable shoes and clothing. Wait an hour after a meal before starting my activity. Do stretching exercises before my walk, and that I slow down at the end to recover well. Am able to talk while walking. If I cannot talk or have difficulty breathing, I am walking too fast. I must slow down. Do not lift or carry heavy objects for the first 6 weeks.
This presentation contains a lot of information, but essentially, you must stop smoking, exercise regularly, eat well, take your medication as prescribed, and basically listen to the advice that was given to you today by the different health professionals.
For more information, you may contact your doctor, your pharmacist, a dietitian, a nurse, the Cardiac Rehabilitation Program, Cardiac Wellness Program, the Heart-to-Heart Program of the New-Brunswick Heart and Stroke Foundation.
Coming to the Cardiac Wellness Program, I found out a lot of things. And they've also helped me get through day to day. Exercising, and not only that, being with people that have more problems than I do. And it just makes you feel better. And it helps you, make it through one more day.
I contribute my ability to do well at this point to the Cardiac Wellness Program, to the doctors, and to God, who decided to keep me around a little longer. And, but I do have to, at this point, I do have to watch my diet. I do have to take my medication appropriately. And I do have to keep coming to cardiac wellness. I'm a lifer.